So one myth is that it will, quote, fry the bowel. What that refers to is the concern that it might damage the rectum that is right behind the prostate. Now, to be fair, any treatment comes with some risk, and there is a risk of damage to the bowel. The reality, though, is with modern technology, the computers and better treatment machines, the risk of that is kept relatively low. And so men can comfortably proceed with radiation therapy without concern that, they're guaranteed to have, quotes, a fried bowel, end of quotes. That is certainly one major myth, and people often hear that from referring doctors sometimes, so that's something to be aware of. Another myth people will have is that radiation commonly causes cancers. So men will say, well, I'm not going to expose myself to radiation. I'll just get a cancer. Now, again, statistically, there is always some risk of almost anything. And it is true that exposure to radiation does bring with it some risk of what's called a radiation-induced second cancer. That is, a radiation that was brought, or a tumor that was brought about because that man was exposed to radiation. The long and short of that is that the smaller part of the body that's exposed to radiation, the lower the risk. And you can imagine the prostate being not a very big thing at all. What that means is when you're giving radiation for prostate cancer, you're treating a very small volume in the body. And so therefore, what we can say, and there's certainly lots of literature to back this up, that the risk of getting a radiation-induced second cancer from external beam radiation therapy is extremely, extremely low and can commonly be overstated. Another myth will be that radiation is like chemotherapy, that it might damage the immune system and the blood counts. Now, radiation can be like chemotherapy in that regard, in that if you radiated the entire body, including all the bits of the bone with the bone marrow in it that produce the blood cells, yes, that would happen. But since treating prostate cancer and treating the prostate is giving radiation to a very small part of the body, basically we hardly ever see effects on the immune system. And that comes up because a lot of people who feel that natural therapies are better will say that they're better because of the effect that things like radiation therapy can have on the immune system. So that would be another myth. Another myth might be that basically if you take radiation therapy, it will interfere with the effect of other things that men may want to do. So there is some scientific basis to the idea that healthful practices like exercise and good diet and particular elements to good diet may be good for prostate cancer. So that is not out of the realm of what we talk about as physicians and scientists. So people worry that it's an either or. You either do the healthful things or you do radiation because the radiation interferes with those things. In fact, that is not true. And we actually encourage men to pursue those healthful practices while they are having external radiation. And on that note, sometimes people feel that they're going to feel terrible during external beam radiation, generally speaking, so that then they can't do all those healthful things. They won't be able to eat properly and they won't be able to exercise. Quite the contrary is true. Most men who have external beam radiation feel quite well and are able to continue their lives. They may be a little bit slowed down, and of course slowed down includes having to come visit us for half an hour each day, Monday to Friday during the week, which can be a little annoying because it's like going to the doctor every day, 5 days a week for 7.5 to 8 weeks. But apart from that, men, they golf and they play tennis and they do all sorts of things. Other things that the myths that radiation involves burning and frying and barbecuing and all sorts of things like that. In fact, the effect of radiation is not one of burning. What it does is it affects cells that are growing. So that can be normal body cells, but the thing that's different about normal body cells versus cancers is they recover from the radiation. Cancer cells, being abnormal, lack the ability to do that nearly so well. So what happens is cancer cells, after they've been radiated, when they try and grow, they die. they aren't able to repair the effects of the radiation. And so that's how the radiation works. So it doesn't cook things or heat it up. What it does is it damages the control center of the cancer cell, that is the nucleus with the DNA in it, so that when it tries to grow, which we don't want it to do, it dies.